Hello, my name is Bhuwnesh Agrawal. I'm also called BA. I'm the CEO of Sysmex Inostics. Cancer is in our DNA, literally. Unfortunately, some of us may have to face it. We at Sysmex are working on making it more easily treatable and no longer something that we have to fear. No two cancers are alike, and the same goes for patients. I'm a doctor who has treated cancer patients in the past, and I've seen the effect that this disease has. That's why specific diagnostic methods are vital in facing these challenges together. And this is where liquid biopsy can offer valuable information, but only if it's sensitive enough. We often still use methods that were developed decades ago by doing imaging, where we see cancers only where they've reached a certain size. But great strides in treatment and molecular classifications have been made, and we're taking full advantage of these developments with our new, highly sensitive and quantitative liquid biopsy tests. We've developed two liquid biopsy test kits called Plasma-SeqSensei. We've named it Plasma-SeqSensei to underline the sample type, plasma, the technology, Seq for next generation sequencing, but also to show Sensei that this is a transferable technology. Sensei in Japanese means master, and this can be mastered by anyone with a laboratory training, including the analytics and the reporting part, the bioinformatics, to bring NGS-based liquid biopsy to the clinics and to the patients. We've been working on these kits for quite a few years now, and the aim was always to bring it closer to the patient. That's why we are happy to share that we have just launched two Plasma-SeqSensei kits, which are IVD certified. The solid cancer IVD kit for colorectal cancer, non-small cell lung cancer, melanoma, thyroid cancer, and pancreatic cancer, and the breast cancer IVD kit. Our mission is to support pathologists and oncologists by delivering essential genetic information as quickly as possible. We work closely with partners to deliver innovative diagnostic solutions and therapeutic support that address patients and their therapy individually. Thank you very much.